Hi everyone, it's Monica Moore, and today on this edition of Ask Monica, we're going to be talking all about pre-implantation genetic testing. And in order to do this, I'm going to show you, hopefully on my whiteboard, hopefully that we'll be able to see. So let me just get you to that now and see if I can get this. Okay. So I'm going to go out of the picture now just so we can talk about this. So PGS or PGT-A, it really depends on the center where you are, stand for pre-implantation, so prior to transfer genetic something. So if it's an S, it's screening. If it's a TA, it is testing for aneuploidy. And what these do is they test the embryo for the abnormal number of chromosomes prior to implanting them in you. And so what we know is that most first trimester pregnancy loss, so most pregnancy loss within the first 12 weeks, is probably or likely due to something called aneuploidy, which is a fancy word for the abnormal number of chromosomes in an embryo, which usually will cause either implantation failure, so not getting pregnant, or a pregnancy loss. So until relatively recently, there was no way to test for this, but now there is. And I'm going to explain to you the process by which we test the embryo prior to transfer. And if it has the normal number of chromosomes, which is called euploid, then we will transfer it back. If it has the abnormal number of chromosomes, then we won't. So how do we determine this? Let's see if I can get this in here. Okay, so a day 5 embryo, or the stage at which an embryo implants, is called a blastocyst. So this is an embryo with hundreds of cells. These outer cells are called the trophoblast cells, these green cells, and they become the early placenta. Then there's a big cavity in here, a fluid-filled cavity, and then here is the inner cell mass, which becomes the baby. And so within each of these cells have a complement of chromosomes. So here, it's difficult to see, but these are 46XX. And almost always, rare occasions not, but almost always, what happens at the placenta is what's happening in terms of the inner cell mass. So you will do an IVF cycle, we retrieve the eggs, we fertilize them, they grow and become blastocysts on day 5 or 6. And then what we do is we biopsy some of these early placental cells. So we take a little section out of these, we put it on a slide, and then we send it to the lab. This embryo, though, remains with us, this blastocyst, and we freeze it. We have to freeze it because we have to wait for these results to come back. So we take a sampling of these placental cells, usually about, so just so you know, there's over 500, hundreds of cells in here. We take maybe 3 to 5 cells out of the placenta, send them off to the lab and analyze them. And if they come back 46XS or 46XY, that is a euploid or normal embryo, so female or male. The embryos, like I said, remain with us in the lab. So when we get the results back, let's say that you have 5 embryos, and the lab sends us results back. They say embryo number 1 was normal, embryo number 2 had an extra chromosome, etc. Then what we would do is we would transfer back that normal embryo. And the normal embryo that we transfer back really depends on if you have a preference for gender, if you'd rather if male or female, and if one of them, in terms of what we look for in the lab other than chromosomes, looks better to us. There are certain other parameters that we use. Really, the chromosomes are the most important, but there's certain other parameters that we use, and we transfer them back. So then you would have any of your normal embryos, let's say this was normal and this was normal, would then be options to transfer back. So out of those 5 blastocysts that we biopsied, 2 were normal. So then you would have 2 embryos to transfer back, assuming you took 1 embryo back at the same time. So that is pre-implantation, so prior to transfer, genetic, either testing or screening. And what we're looking for in this particular situation is something that we call aneuploidy. And we want to make sure that we are ruling out or not transferring back the abnormal number of chromosomes in an embryo, because it's often or very likely that either that won't create a pregnancy or won't cause you to have potentially a pregnancy loss. So that's how it works. As always, please feel free to ask us any questions. If on this particular topic you want to know something more nuanced or your question wasn't answered, please feel free to reach out to us as well. Thanks so much and have a great week.